years into the pandemic, President Biden just announced the launch of covid.gov, a new website for resources on vaccines, COVID treatments, mass testing, and updates, all involving COVID-19. This comes as the White House urges Congress to provide more funding now to keep these resources available during the pandemic. For more, let's bring in ABC News senior nationally policy reporter Ann Flaherty. We're also going to hopefully talk with John Brownstein once he gets connected to us as well, and to get the doctor's perspective. But let's start with you. The Biden administration now asking for more COVID-19 funding from Congress. What exactly is Congress proposing in its plans here for the COVID funding?
Well, the Biden administration says at least $22 billion more is needed to cover the cost of these vaccines. We've seen these vaccines for free. That could all come to an end if Congress doesn't pony up more cash. We also need more money for testing, the monoclonal antibodies, and these pills like Paxlovid by Pfizer that's been shown to be 90% effective if you take it within the first 5 days. All of this costs money. The Biden administration says that they are out of cash to continue these treatments and option these tools for the next 5 months, and we could start to see that coming to an end. Democrats can't agree on where the money should come from, and Republicans say they want to see it paid for. So right now it's stalled in Congress. What we heard from Biden today is don't give up now. We need to keep pushing ahead on this.
All right, Dr. Brownstein, without more COVID funding, communities across the country could lose access to COVID-19 resources. What's at stake if that funding drops?
You know, what's at stake is all this incredible work that we have made and this progress that has been made on this pandemic is going to start to wash away. All the efforts around personal protective equipment, vaccines, testing, therapeutics, all that access that we know, those fundamental ways in which we're going to control the pandemic will start to go away. And we're going to be back to sort of 2019 efforts to control pandemics. And, you know, we have this BA.2 variant that is emerging. We have no idea what that will be in store for us, but clearly we will have other variants emerge. We are not at the end of this pandemic as much as we'd love to be. We will have other variants, and it will test our ability to respond. And if we don't have those tools in front of us, then unfortunately that will mean unnecessary hospitalizations and unfortunately deaths. And we've come such a long way. It's really unfortunate for us to backtrack so far to where, you know, essentially we started.
Yeah, it's the last thing we want to do is backtrack. We're just starting to kind of feel like we're getting our lives back to normal in some ways. And what do you make of the covid.gov website? And why do you think the government didn't release something like this, say, 2 years ago?
Well, you know, the data collection on this has always been a huge challenge. I remember early on in the pandemic, the White House actually went to hospitals and said, can you email us your data? Tell us how many people are in the hospital at this moment with COVID. That's how behind we were when this pandemic first started. I think people forget how underfunded a lot of these public health agencies were. So certainly, you know, John Brownstein had a big role in this, trying to get some of these websites and this data off the ground. All they've done now is to combine it. We have seen this online in the past. This just makes it a one-stop shopping. You know, I don't think this is going to be a game changer for anybody, but it certainly makes it easier as we head into this future. You know, John was bringing up the concerns that we have. We're really going to separate into these two Americas, people that know that it's their turn to get boosted. They have insurance that can cover it. And then there's going to be another side of America where they won't get the time off of work, for example. The mobile vans are gone. So that's a really big concern, that we're not going to throw these resources at making sure that people who are the most vulnerable are going to get these. So this is part of the Biden administration's plan to try to make this easier on Americans.
And Dr. Brownstein, you recently co-wrote an ABC News article titled "Decline of Testing Sequencing Could Hinder Surge for Future COVID-19 Variants," experts warn. So how concerned should Congress be when assessing COVID-19 and potential new variants? And by the way, you can go to abcnews.com and read your article.
Great. Yes. Thanks for the plug to the article. And what essentially we are saying is that the funding for testing, as it goes away, as testing sites go, we are starting to fly blind. We do not know when someone tests positive. We don't have the ability to sequence that person. And as we know, early identification of surges, early identification of variants is how we stop this pandemic. And so the concern is right now, and yes, it's wonderful that people are using home tests. That is an amazing aspect of this pandemic, consumer choice and the ability to identify infection. But if you don't have funding for testing, you don't understand what's happening. And unfortunately, this is how we get caught flat-footed again with a new variant, another surge, and we don't have the ability to respond effectively. So that is one element where we really need to put some deep funding and long-term funding behind.
John and Ann, thanks guys so much.
Thank you.
Thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.